Well, Esana Plastic Surgery Center and Med Spa offers a full spectrum of sophisticated and advanced cosmetic care under the close supervision of two doctors. Joining us today is Dr. Deborah Pan and Dr. Javier Davila, both here to talk about body contouring with liposuction. Welcome back, you two. Great to have you, Dr. Pan. Good to see you.
So good to see you.
Now, I think a lot of us kind of have an idea what liposuction is, but for those at home who may not understand, what exactly is it?
Well, basically what we do is any area of the body that has excessive fat deposits, we can actually dilute the area out and numb it, and then essentially break it up and suction it out so we can change the contours of the skin and thin that fat layer right underneath the skin.
Who do you think is really a good candidate, or how do you know if you're a great candidate for lipo?
What you have to see is you have to have areas of fat that you can delineate and determine in certain places. So it's not a good procedure for general weight loss, but it's really more to reshape the body. So you've got to have an amount of fat that you can take out, and you've got to have skin covering it that has the ability to shrink back.
Okay.
So that in the end, things look smooth.
That's the idea here, is make sure you look smooth and great. Now, do you actually go under anesthesia for this, or no?
You don't necessarily have to. It all depends on how much and how large of an area you are proposing to want changed. If it's a small, minor area, something that we feel safe doing in the office, we will propose that to you. But if it's something fairly extensive and we feel that we really need to have you comfortable so that we can take out as much fat as we can, which is in your best interest, then we will suggest going under anesthesia for that.
Okay, perfect. Which kind of leads to the next question I have. I mean, you do some stuff in the office, but also at the hospital.
Correct.
Okay, good to know. And we have some pictures, some before and afters, which I think are really significant changes to people. So let's take the first picture, and doctors, walk us through what we're seeing here.
Okay, what you're taking a look at there is on the left, you have a neck that's poorly defined, and you have a little fat collection behind the chin, which gives it sort of the double chin appearance, especially when you take a picture head on. And so by taking out the fat over there, you can give it a better angle of the neck, and you can see that it's much more defined.
And Dr. Davila, what's interesting here is that we're talking about liposuction, and as I mentioned earlier, sometimes we think, okay, well, liposuction, I automatically think you're going maybe for the thigh or the stomach area. But like you said earlier, it means you can do it from the chin.
Right, and areas that might bother you, certainly come in with your questions, and we can point you to what is possible, what's not possible, and what the expectations can be.
Perfect. Let's take picture number 2 and then walk us through what we're seeing here.
Basically here, this is a liposuction of the upper thigh and the buttock area, and basically she came in, before pictures are on the left, where there's really no definition between the buttock and the upper thigh. So what we did there was kind of reshape the upper thigh so that now you have more of a break and a definition of the buttock.
It looks really smooth. And then let's take the third picture if we can, and then walk us through what we're seeing with this particular picture. Wow. That looks amazing.
Here what you're looking at is the abdomen, and you can see that there's some bulging in the before picture on the left, which then becomes flattened out, and you can see the muscle tone much better on the picture on the right. And you can also contour that yourself, meaning the surgeon, bringing that down so that the muscles pop up much better.
They do pop out a lot better. Let's talk about pain, though, the pain level. How much pain is associated with liposuction?
Remarkably, not too much.
Okay.
It's not a surgical pain because we're not incising the skin, so there's no stitches, there's no large scars. It really feels more like a bruisey sensation. A lot of my patients tell me it's like a very severe workout, and a day or two later you feel kind of sore as you twist or move, but not anything that holds you back from doing very much. You're up and at it, you're walking immediately afterwards, and depending on the amount of area done, you actually could be back to work within a day.
Back to work in a day and looking fabulous. Okay, so I like that. Let's talk a little bit about liposuction versus a tummy tuck. And as doctors, what do you recommend, and then how do you kind of share that information with your clients? What works best for who?
Well, it has to do with the concerns of the patient and their age, what they've gone through in life. For example, if you've gone through pregnancy, you can benefit from having your muscles tightened, and that would be a tummy tuck. If you have excessive skin hanging, you also want to resect that, so that would be a tummy tuck. But for somebody who has just a little bulging fat, kind of like the picture that you saw, and you have skin that will recoil back, you can do liposuction and get a great result.
I like that. But let's talk a little bit about this May Makeover Madness event that you're having May 20th. Is that right?
That's correct.
Tell us about this, and everybody listen up because it's going to be a lot of fun. I might even have to drop in for this one. All right, take it away. Tell us about it.
Basically, Thursday night, May 20th, we're having a makeover event. We were going to have the sponsors and the manufacturers of Botox, Latisse, and Juvederm there to answer questions. We'll just be having an informal discussion about the latest beauty trends, the beauty treatments that we have going on. We'll have goodie bags for all attendees. special pricing for special procedures for that night only. So if you're there, you will be privy to those. Oh. And we'll also have some raffles for some gift certificates. Joe Bella Salon is participating as well.
Wow.
And we'll have food and refreshments. But the important thing is that you do need to call the office and RSVP because space is limited.
Okay, so good. We're going to RSVP. And again, goodie bags, ladies and gentlemen, need I say any more? We're putting the information on the screen. This is how you RSVP. We'll leave that up there. They're located here in New Haven, Esana Plastic Surgery Center and Med Spa. It's www.esanamedspa.com. The number is there. WTNH.com. Click on Connecticut Style if you missed any of that. Dr. Davila, Dr. Pan, thank you so much for being here.
Thank you so much.
Thanks, Dr.